listen-only mode.
Hello and welcome to the County Health Rankings and Roadmaps 101 webinar with the tour of our website. My name is Jan O'Neill and I'm a community coach with the County Health Rankings and Roadmaps, and I'm joined by my colleague Karen Odegaard.
Hello, I'll be helping to answer questions today and leading a tour through our website. Looking forward to spending some time with you.
Great, and we'll be also sending out links via the chat box. First, we would like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. This program is the result of the contributions of many partners, including those listed here. And next, we want to take a moment to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window, where you will see our screen throughout the presentation, and on the right, you can see the control panel. And here, where we're clicking, you can see where you'll find the handouts for today's session, including a PDF of our slides and a list of related links that we'll be sharing during the presentation. You can also interact with us through the control panel by using the questions section. Please feel free to ask questions or share your thoughts and experiences with us via the control panel throughout our webinar today, and we'll be sure to leave time for your questions. You'll also see that we've made this an open webinar so that people can see each other's names and follow up individually if someone asks a question that you're particularly interested in. So here's a look at what we're going to talk about today. We'll start with an overview of the County Health Rankings and Roadmaps program, and then we'll demonstrate how you can use our site to explore the rankings data. We'll also talk about tools for taking action and take a look at how the Roadmaps Action Center can help you move forward with action and how you can learn from others. Throughout the webinar, we'll head over to the countyhealthrankings.org site to see how the site functions, so you'll walk away from today's webinar able to confidently navigate the site. As we go through the webinar, if you have an idea or a thought, a tool, or an example, please feel free to enter these in the chat box, and we'll make every effort to share them with everyone on the call. And specifically, we encourage you to think about who else you need to share this information with, and what's one idea for action that you can take away from this webinar, and also what else do you need to know to take action and use this information. The Robert Wood Johnson Foundation has laid out a powerful vision for building a culture of health in every community in the country. That vision includes the belief that all individuals and families should have the means and the opportunity to make choices that lead to healthy lifestyles, regardless of where they live. So we start this webinar with this guiding question: how can County Health Rankings and Roadmaps help you build a culture of health in your community? This image comes from Cambridge, Massachusetts. They had all of their community partners put their names on a strip of fabric, and then they wove them together into a tapestry. It visually represents the power of collaboration to bring diverse partners together to create something new. Partnership, working with diverse partners from all walks of life, is one of the ways Cambridge is building a culture of health. So what does your tapestry look like? Is it helping you build a culture of health? How could you strengthen it? Similarly, the County Health Rankings and Roadmaps program is made up of many components that work together with a common purpose: to build a culture of health county by county. As we share the various components that make up the County Health Rankings and Roadmaps, we invite you to think about which piece or pieces of the program you can use. So let's start by reviewing a little about the County Health Rankings. This picture shows the thinking behind the rankings. It's our theory of change about how rankings can be a catalyst for action that improves the health of everyone in your community. We start with population-based data from a variety of sources. Then we use that data to rank the health of nearly every county in every state. The rankings take several different pieces of data and simplify them. They give communities a quick and easy snapshot of their health and of the many factors that impact how well and how long people live. Each year, the rankings release, which is in the spring, generates national, regional, and local media attention. Some of you may have read or may have been quoted in stories about how your county compares to others in your state. This provides an opportunity then for people to tell the story of the many factors affecting health in their community. Community leaders can and do use the rankings release to get the word out to their community and local media to help people understand the health status of their community. They use the findings as an opportunity to mobilize multiple sectors to look further at their community's strengths and needs. And based on this deeper look at their unique priorities, community members identify evidence-informed strategies that can be implemented locally to make change. Over time, these evidence-informed strategies ultimately result in longer, higher quality lives for all the children and adults in the community. Essentially, the county health rankings aren't about numbers. They're all about a call to action. The county health rankings are a starting point for discussion in communities, not the ending point. Communities will want to dig into local data to further understand what's going on in order to know where and how to take action. The horizontal portion of the model underpins the rankings. The county health rankings show us that where we live matters to our health and that a broad range of factors impact how long and how well we live. The vertical portion of our model underpins the roadmaps. The roadmaps offer communities guidance, tools, and resources to move from awareness to action to create healthier places to live, learn, work, and play. So we're going to start with the rankings. The County Health Rankings ranks the health of nearly every county in every state, and for each county you will find two rankings, one for health outcomes and one for health factors. There are two separate sets of messages to be conveyed here. How healthy a county currently is, and these are health outcomes. Note the green, you'll see this in the next slide. We call this rank today's health. How healthy a county might be in the future based on the many factors that influence health. Health factors, which are in blue, and we call this rank tomorrow's health. So you'll see these colors in this next slide. This is one of the most important images we'll share with you today because it shows what we use to determine the county health rankings and what influences health in a community. This model shows the relationship between policy, health factors, and health outcomes. It illustrates how multiple factors impact how well and how long we live. Things like how we commute to work, housing conditions, access to parks, the quality of our schools, availability of jobs, access to healthy foods, clean air and water, and our social connectedness. All of these impact our health outcomes. So starting from the bottom, we know from the research that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. Many health factors, and these are in the blue boxes, shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. We measure two types of health outcomes, these are in the green boxes, to show how healthy each county is, the length of life and quality of life. So as an example, expanding early childhood education improves academic achievement. Higher levels of education lead to higher levels of income, which then influence other health factors such as access to healthy foods, clinical care, and quality housing, which in turn influence health outcomes. Now, stepping back, you'll note that we don't include race or ethnicity in our health factors. We've selected health factors that reflect aspects that communities can improve. Race and ethnicity are not modifiable, while poverty is something we can take action on. So you will see income as a key health factor. We do provide data, tools, and resources that can help communities address health disparities, and we'll show you where to find these on our site. The bottom line is that factors such as one's race, ethnicity, and socioeconomic status should not play a role in how healthy we are or how long we live. But unfortunately, for many people across the nation, they do. If we are going to build a culture of health in every community, reducing health disparities needs to be a top priority because everyone in our society deserves an equal opportunity to pursue a healthier life. As we talk about building a culture of health, where everyone in a community has equal opportunity to enjoy good health, we are discussing health equity. This means creating a sense of community where all individuals, especially those most affected by poor health outcomes, feel they have a voice and a role to play in creating and implementing solutions. Healthy People 2020 calls for valuing everyone equally, addressing avoidable inequalities, and eliminating health and healthcare disparities. This includes a shared commitment to identifying and addressing gaps in opportunity that tend to disproportionately and negatively affect certain populations. Health equity is a basic principle that all people, despite race or ethnicity, limited English skills, gender, age, religion, income, educational level, geographic location, sexual orientation, or ability, have equal opportunity to lead healthy lives. So stepping back to the model, having looked at many factors that make up health, let's now take a look at how the measures are selected. As we mentioned, we want communities to take action, so we use measures that reflect aspects of a community that can be improved. We use measures that are valid, reliable, recognized, and used by other similar national measurement or rankings projects. For example, many of our measures are used in America's Health Rankings, which annually measures the health of states. Our measures must also be available at the county level for every county in every state. And not only must they be available, but they must be available at low cost or free, and they have to be as up-to-date as possible. We use fewer measures, there were 35 in 2015, because the rankings are meant to just be a snapshot. The data is just a starting point for communities. So having looked at the model and the measures, now we're going to take a brief look at a county example. What does it look like on our website? And Karen will take us into the website now.
Great, thank you, Jan. So we are going to take a look, we're going to start with the homepage at countyhealthrankings.org. First, I want to start with this navigation bar at the top of the page. The navigation bar will remain at the top of your page throughout the site. It's a great way to navigate around the full site with just a few clicks from the bar. No matter where you are on the website, you can always scroll up and click the County Health Rankings and Roadmaps logo to get back to our homepage. So let's take a look at this orange navigation bar. The first thing that we see is the rankings menu. From here, you can access information about our approach, the rankings methods and measures, and measuring progress, as well as tools to help you understand and use your data. Next, you see the Roadmaps menu. Here you can access tools to help you take action and learn from others, and we're going to talk about this in more detail in a little while. And then you'll next see the tab for the RWJF Culture of Health Prize. Here you'll find information on past prize winners, including their stories and videos, as well as the current finalists. You can also learn more about how you can apply for the RWJF Culture of Health Prize. And then under the More menu, you'll find tools and resources, webinars, frequently asked questions, and the About section, where you can find out more information about our program, including learning more about the Roadmaps to Health Coaching. In the middle of your page, you'll find a map of the United States. You'll also see a search bar above that, where you can enter your county or state name, or you can also search for your county snapshot using the main search bar up on that orange navigation bar. Below the map, you can select a measure from this drop-down menu to get more details on any of our measures. So to begin to explore the rankings, we're going to click on the map, and we're going to go ahead and click on Wisconsin for the purposes of our discussion today. And I'm going to eventually take us to Dane County, Wisconsin, which is where we're based here at the University of Wisconsin Population Health Institute. So this brings us to our state overview. This page shows both your health outcomes map in green and your health factors map in blue. And again, those are helping us think about today's health and tomorrow's health. From this page, you can download data. I'm going to scroll down a little further here. You can download data. you can find additional data sources under Find More Data. So this is an opportunity to see if your state offers more data at sub-county levels. You can also browse for community health improvement resources for your state. You'll find stories from your state as well as state contacts. You can also link from here to the Action Center, which again we'll talk more about in a bit. So I'm going to scroll back up to the top of this page, and again from your state page you can either select your county from this drop-down menu or by clicking on the map directly. So I'm going to click on the map to take us into Dane County. This takes you to your county snapshot. Across the top of your snapshot you see a number of tabs. These tabs offer another way to explore your data. You can use these tabs to explore the measures, to get to downloads for your state, and to compare multiple counties within your state. Turning to the snapshot, in the first column you'll see our measures. So again, we have 35 measures in the County Health Rankings. Over on the right, you'll see two overall ranks, the Health Outcomes rank and the Health Factors rank. You'll also find ranks for each health outcome and health factor in this far column. Your snapshot contains 4 columns of data. First, you'll find your county data. Here we see data specific to Dane County, Wisconsin. Next, we've included trend graphs for 12 measures where we have sufficient trend data. You can see a detailed graph of the trend data by clicking the graph icons. And we have color-coded each icon to help you quickly see whether your county's estimate is increasing, decreasing, or staying the same over time. The red graph indicates that your county is getting worse for this measure. Yellow indicates that your county is staying about the same. And green indicates that your county is getting better for this measure. So if we scroll down, we can take a look at the trend graph for children in poverty as an example. So I'm going to look at children in poverty under our social and economic factors. And here you'll see your county's trend in blue, the state's trend in green, and the national trend in orange. If this is a graphic that you're interested in using at a later time for a presentation or a report, you can simply right-click on this graphic and save the image. So that's just a little tip if you want to come back to this or save this for your own presentations. So in the next column, you'll see the error margin. We use a 95% confidence interval. Basically, this means that we are about 95% sure that the actual number for your county is in the given range. In the fourth column, you'll find the top U.S. performers. We include the top U.S. performers as an aspirational value, as only 10% of counties in the nation do better than the given number. Finally, you'll see your state column. This allows you to compare your county's numbers to your state overall. The areas to explore highlights potential challenges a community may want to examine more closely. So you can turn this feature on, and when you do, orange boxes will highlight areas to explore based on health factor measures that seem to have the greatest opportunity for improvement. The county snapshot also includes additional measures, which provide some additional data that may be especially helpful to you, but that we do not use to calculate the rankings. I wanted to highlight a new measure that we included in the 2015 rankings, and that is our income inequality measure. So again, we'll scroll down and we'll find this measure under social and economic factors. Income inequality has joined children in poverty as a measure of income in counties. This measure was added due to the growing understanding that not only the average level of income in a county is important, but also the distribution of that income among households in a county. So our measure of income inequality is the ratio of household income at the 80th percentile to income at the 20th percentile. A higher inequality ratio indicates greater division between the top and bottom ends of the income spectrum. So we're going to dig a little bit deeper and take a closer look at one of our measures. We can do this in a couple of ways. You can learn more about each of our measures by clicking on this Measures tab here at the top, but you can also click on the measure name directly from your snapshot. So we took a look at the Children in Poverty trend graph. Now we're going to actually click into the measure detail for children in poverty. All right. So the measure detail, this is the measure detail page for children in poverty. What we first see here is a map. And the maps of individual measures, for the maps of individual measures, we use the distribution of underlying values, or the z-scores, to display the spectrum of values in a state. So you can see in the map here that counties with particularly poor health values are colored in a deeper shade of blue, or for health outcomes in a deeper shade of green. And counties with particularly good health values are colored a lighter shade. Once again, when we go back up to the top, you'll see that we have progressed along those tabs at the top, and we have a new set of tabs here to measure that are specific to the measure detail page. From these tabs, you can look at detailed data for this measure. You can see the full description, including why we use this measure. You can learn more about the data source and begin to browse relevant evidence-informed policies and programs from What Works for Health. To the left, you'll see a brief description of the measure, a little bit about our rankings methodology, and summary information for this measure. You can navigate to other measures from here as well, using the orange box in the top left-hand corner. Also included some tools on our site that can help you understand your rankings data and to think about how you can measure your community's progress over time. So I'm going to go back up to this orange navigation bar at the top of the page, and you can use this rankings menu to get to using the rankings data and measuring progress. So we're going to slip into using the rankings data for just a moment here. This tool helps you find and understand the data on our site and beyond as you begin to assess your needs and resources and focus on what's important. It includes a section on digging deeper. You can see that here to the left, which can help you think through what other information would help you further understand the health of your community. It also helps you understand when sub-county data may be available for specific measures and where you can find it. Another section, Finding More Data, directs you to additional national and state data sources. Now we're going to take a quick look at another tool that can help you understand your data and your progress. So I'm going to go back to that rankings drop-down menu and select Measuring Progress. Measuring Progress is a tool that helps you understand how to use rankings measures to measure your progress, where to look for other data that can help you tell your community's story, and how to tell if your community is poised for progress. So as you can see, countyhealthrankings.org offers a number of ways to explore your county's data as a starting point for change. So this brings us to roadmaps, which can offer communities resources to move from awareness to action. So I'm going to turn it back over to Jan to introduce that a little bit more.
Great, thanks, Karen. So hopefully you now feel comfortable finding and using your county snapshot. And so as Karen said, we're going to go back now to our thinking behind rankings and roadmaps and really focus on roadmaps. Roadmaps addresses the vertical section of our change theory here. Now that you have your community's attention, you want to be able to find the best possible strategies to impact your community's health priorities. And this is where communities take action to improve health, but the question is how? How do we do this? And how do we do this with a health equity lens? Along the way, we're going to point out some guidance tools and resources in our Action Center. And from working together to evaluating your efforts, the Action Center provides a variety of tools and guidance to assist communities in taking action. And Karen is chatting out the link to our Action Center. The Action Center is an online sort of one-stop shop. It's a platform which provides practical help for communities working collectively to improve their health. It provides guidance and tools to understand the data and strategies that communities can use to take action. It also provides access to community coaches, which we'll talk about a little bit later in this webinar. So Karen is now going to take us back into the site where we can take a look at the Action Center. Karen?
Great, thanks, Jan. Okay, so returning to our website, we're going to again go up to that orange navigation bar at the top of the page, and we're going to click on the logo to take us back to our home page. So we can get to Roadmaps resources in a couple of ways. We can use the Roadmaps menu, Roadmaps to Health menu right here on the orange navigation bar, or we can access the Action Center by clicking on the Get Step-by-Step Guidance from the Action Center box to the right of the US map. Before we head to the Action Center, I want to show you the Roadmaps menu and some other options that you've got there. So if we pull down that Roadmaps to Health menu, you can see the Action Center. You can also see what works for health. We're going to sort of bookmark those for the moment and come back to that in a bit. I also want to point out the Roadmaps to Health coaching. This is a great resource that we have that provides local leaders anywhere in the country with direct support from community coaches to strengthen their capacity to advance health in their communities. This service provides guidance in how best to strengthen partnerships, to enhance skills in a strategic manner, or to navigate challenging policy advocacy choices. So this could be a short phone call or a longer-term coaching agreement. Most coaching is provided through distance learning technology or phone contact. And again, you can find out more about Roadmaps to Health coaching by clicking right on that link from the Roadmaps to Health menu. We also know that it's valuable to learn from other successes and challenges. So we've included stories and project showcases sections to highlight examples of communities and organizations that are taking steps to improve health from across the nation. And finally, you can also learn about our national partners who may be able to help you engage other partners and leaders locally. So let's take a look into the Action Center. The Action Center includes a guide for each step in the Take Action cycle. The guides describe the key activities within each step and provide suggested tools, resources, and additional reading. You can start and assess or enter the cycle at any step. At the heart of the Take Action cycle are people working together, because we believe that people from a wide variety of sectors have a role to play in improving a community's health. You will also see that work together and communicate circle around the cycle, because working together and communicating with stakeholders and partners are essential throughout the Take Action cycle. As you can see, this image is interactive. You can click on each of the steps or any of the partner bubbles in the middle, and it will take you to a guide for that step or that partner. There's also a navigation bar on the left, which links to each of the steps and each of the partner guides as well. So what will you find in the guides for the action steps? The guides describe activities within each step and provide suggested tools, resources, and additional reading. You can also simply start on this page by hovering over your mouse over each step in the Take Action cycle to see some of the questions that the guide addresses. This will help you understand the different steps before actually diving into the guide. So let's take a look at one of these guides. I'm going to scroll up and click on Work Together. So here you'll find a brief description of the step, the purpose, and who to involve. Scrolling down, you'll see that we've broken each step down into key activities so you can find the most relevant guidance and tools for where you are in this step. When you find an activity that is of interest, you can open it and read the guidance and explore links to related tools. So let's click on Recruit Diverse Stakeholders from Multiple Sectors. All right, as we come into this key activity, we'll find every tool includes we'll see 5 tools visible when you first click into it on the right-hand side here. And if there are more than 5 tools for that activity, as there are for this one, then you can click on View All Tools to find the rest of those tools. You can also look for communities and action stories. These are scattered throughout the Action Center and What Works for Health. They provide examples of programs, policies, and tools in action. So here we see an example of a community in action, and this one comes from the United Way of Greater Toledo. It explains how they use 3 of the tools included in this key activity. So if we just pop in here for a moment, you can get a sense that these are not long. They're fairly brief, and they just give you a sense of how communities are taking action, either on one of the key activities or on a strategy in What Works for Health. I'm going to take us back to this key activity on recruiting diverse stakeholders from multiple sectors. I also want to point out that on the right you'll see a Get Help button. You'll find this throughout our site, and it invites you to contact our team for personalized free help. Clicking on this will take you to an email form that goes to one of 11 community coaches based around the U.S. who, thanks to the support of the Robert Wood Johnson Foundation, can be in touch with you to help you think about what your next step is or which tools might help at no cost to communities. And then, of course, in the bulk of this page, you'll see guidance, tips, suggestions for how to do this particular activity. I also want to point out that you can search for tools in the search bar at the top of the page. So you can use this search bar to search for tools, for any specific tools that you might be looking for. I'm going to send it back over to Jan for a moment to talk a little bit more about the foundation of roadmaps.
Great. Thanks, Karen. So the roadmaps offer communities resources to move from awareness to action. And there are 4 foundations to roadmaps. First, it takes everyone, all of us working together to improve the health of a community. And secondly, we really need to move as quickly as possible from data to action and not get stuck in analysis paralysis or drowning in data. We encourage communities to look to the evidence to inform these actions, and if you innovate, be sure to evaluate. And third, keep focused across all the health factors, including social and economic factors. And don't be afraid to take on policy, systems, and environmental change, which will in the long run create the greatest long-term change in health for the children and adults in your community. So now, let's take a look at a valuable resource on our site to help you select evidence-informed programs and policies. What Works for Health provides communities with information to help select and implement evidence-informed policies, programs, and system changes that will improve the variety of factors we know affect health. In just a minute, we'll head back to the website with Karen, but first let's talk just for a moment about why evidence matters. Evidence matters because when it comes to developing and implementing solutions to problems that affect our communities, using what's been shown to work can drive smart investments. None of us have a lot of time, money, or resources, so choosing strategies that have been shown to work can help you stretch the impact of scarce dollars and resources. And second, knowing whether there are strategies that effectively address your community's priorities can help inform decisions about when to adopt existing strategies and when to take on more innovative approaches. And third, it's important to understand what's been shown to work and what hasn't when creating new solutions. Explicitly considering what works can help to ensure that your innovative solutions are effective. So let's head back to the website with Karen to explore what works for health.
All right, great. So we are going to find what works for health by going to the Roadmaps to Health menu and clicking into what works for health. So let's just take a moment to get oriented to this main What Works for Health page. On the right, you'll find new policies and programs, so you can see the latest additions to What Works for Health. On the left menu, you can learn more about our ratings and methods. What Works for Health provides communities with information to help select and implement evidence-informed policies, programs, and systems changes that will improve the variety of factors that we know affect health. So if we scroll down a bit here, this graphic here probably looks familiar to you. This pulls from our model and allows users to learn about strategies that could work in your community by selecting a health factor of interest in these light blue boxes on the right. You can also use the keyword search to explore strategies. So let's take a look at one. On the model, let's look at the types of policies and programs that we find under income. Here we find 15 results. From here, you can further filter your results by approach, by decision maker, or by evidence rating. Evidence of effectiveness can mean different things to different people. Our approach to assessing evidence combines what we know from scientific study and the observations of unbiased experts. Each reviewed strategy is assigned an evidence rating based on the quantity and quality and findings of relevant research. So if you click on a strategy, I'm going to click into Increase the Earned Income Tax Credit. You'll find the full entry for that policy or program, including the expected beneficial outcomes and other potential beneficial outcomes. The expected beneficial outcomes are those that the strategy is directly intending to achieve. But we know that some strategies have other impacts. So when the evidence of effectiveness shows other areas that are also positively impacted by the strategy, they are listed in other potential beneficial outcomes. If we continue to scroll down, we'll find the evidence of effectiveness section. This is sort of the meat of the entry. This is where you're going to find any information about whether a strategy works for a specific population, or more details about where it has been used and what's been successful, as well as several links to research, to the literature on that particular strategy. Scrolling a little further down, we see the impact on disparities and implementation examples and resources. So let's talk for a moment about this impact on disparities rating. To determine this rating, we assess each strategy's likely effect on racial, ethnic, socioeconomic, geographic, or other disparities based on its characteristics and the best available evidence related to health disparities. These ratings reflect the usual use of a strategy as presented in the relevant literature. However, if you choose to implement a strategy in a targeted way, that can alter its likely impact on disparities. So for example, if you're targeting efforts to those with the greatest need, that could take a strategy from no impact on disparities likely to actually having it being likely to see a decrease in disparities in your community. This strategy also includes a community in action. So again, you'll find these communities in action spotlights sprinkled throughout What Works for Health in the Action Center. This one highlights how the Kentucky Youth Advocates are working on a statewide earned income tax credit in Kentucky. At the top left of the entry, you'll see the evidence rating thermometer. Hovering over it, you can see definitions for all 6 of our ratings. And that is a quick look at What Works for Health. And now I'm going to send it back to Jan.
Thanks, Karen. So before we move beyond what works for health, though, I just couple more comments about choosing strategies. Remember that the evidence of effectiveness is just one of many factors to consider when you choose a strategy to solve a community health challenge. It's also important to consider your own unique community and how well that strategy will fit with your community and align with the efforts that are already going on, how ready your community is to adopt that strategy, what your community priorities are, where the greatest areas of need are, what your capacity is for adopting that strategy, and what your resources are. So all of these are important considerations when choosing strategies that will work in your community. So as you move forward in your own community health improvement journey and you're working to create health for all, we invite you to focus on 5 Ds. Investigate the differences, using digging deeper and other data tools to understand differences between subgroups. Focus on the drivers that most influence health, policies, systems, and environmental conditions that create opportunities to improve health for all. Dig into the root causes. While all of the health factors affect the health outcomes, be sure and focus on the social and economic factors as they contribute the most to poor health. Determine most effective strategies, especially those strategies that, if targeted toward those in greatest need, will reduce health disparities. And finally, the Nike approach, just do it. Harness the collective power of your community to take action that will create more equitable opportunities for good health for everyone in your community. Now, before we move to Q&A, we do want to take a bit of time here to introduce the RWJF Culture of Health Prize. The prize is a collaboration between the University of Wisconsin Population Health Institute and the Robert Wood Johnson Foundation, and it honors and elevates U.S. communities that are making great strides in their journey toward better health. And here you'll see the 6 criteria that are central to the RWJF Culture of Health Prize. The prize recognizes and celebrates communities that have placed a priority on health and are creating powerful partnerships and deep commitments to make change that will enable all in our diverse society to lead healthier lives now and for generations to come. It's awarded annually by the Robert Wood Johnson Foundation, and communities that are awarded the prize work across health factors by defining health broadly. They're strategically focused on policy, systems, and environmental change, and they look out for all, including the most vulnerable in their community. These communities work collaboratively with partners from across the sectors, use resources wisely and creatively, and they measure and share success widely. To learn more about prize eligibility, criteria, selection process, key dates, and to apply, go to www.rwjf.org/prize, and Karen's putting the chat link in there. The 2016 applications are due November 12th, 2015 at 3 p.m. Eastern Time. We encourage you to check that out. And the process is every bit as powerful as winning. We really encourage folks to take a look at that and even consider going through it as a process of strengthening your community. These are the prize communities for 2013 and 2014, and you can learn more about them and their accomplishments by going to our website, to the homepage, and clicking on the RWJF Culture of Health Prize, and then just click on Past Winners. There you'll find inspiring videos about each of the winning communities. Also, we'd like to mention you can tune in to a live streaming webinar on October 28th at the rwjf.org/prize link to hear about the new 2015 winners. And again, Karen has chatted that link for all of you. So in summary, the county health rankings help us see how where we live, learn, work, and play influences how healthy we are and how long we live. Health disparities exist among racial and ethnic groups in rural areas, among women and children, the elderly, people with disabilities, and other vulnerable groups. The rankings are an annual checkup of the health of each county, and they show us that some places are doing very well and other places have some work to do. and everyone can improve. And that while having health insurance is important, much of what affects our health occurs outside of the doctor's office. It's hard to live a healthy life if you live in an unhealthy place. And improving community health is not something solved by a local health department, hospital, or physician. We need everyone to improve health in the community. All of us need to work together and take action together. You can find practical guidance through our online resources in the Action Center and using the Get Help button to reach a community coach for consultation at any time on your community efforts to improve health. So now, let's see, we've been getting some good questions. We've got a lot of questions, and let's see if we can answer some of them. Before we dive into them, one person did ask about using the archived version of this webinar in a convening that they're having, a meeting, and it will be posted on the site within the week, and you are welcome to go to that and download it and go to different parts of it, whatever you want to use. It's free and open for all. So I just wanted to make mention of that.
Yeah, Jan, let me just add to that also that that a presentation very similar to our 101 presentation is available on our website to download with speaker notes. So that's also available for folks, and you can find that in the Tools and Resources section. And I think you can click right on Presentations in there, and you'll find that downloadable PowerPoint presentation. So if that's of use as well, it's available.
Great. Thanks for mentioning that, Karen. Well, let's go to some of our audience questions. We've got some great questions. One question is how to apply rankings in rural communities. Do you want to tackle that one, Karen?
Sure, absolutely. So I think regardless of where you are, if you're in a rural community or a more urban or suburban community, that a key thing to keep in mind is that the rankings are a starting point, that they're not going to give you every bit of data that you might want, but they're going to be a great place to start, and that the model especially can be a really key tool to help guide exploring additional data that would be relevant to your community. In rural communities, it may be especially important to look for additional data sources, whether it's local data or state data that's available at the local level. Because when the data that you see in the County Health rankings, there will often be more variability in data for smaller communities. And so you'll see a little bit more up and down potentially in ranks. So that's just something to be aware of. To use, again, the rankings are a fantastic starting point, but then to look further at additional data can be really helpful. And again, keeping in mind that rankings model can help you think about what kind of data you may want to pursue. A couple of prize communities are great examples of how they've used the County Health rankings as a starting point, I would say. And so one is in particular that I can think of is Manistee, Michigan, maybe a really great example to take a peek at, where this is a community within a county, and just thinking about how they've used that data to guide some of their progress. So we have another question, Jan, that I think might be great for you to take on. When you are the lowest ranked county in a state, what are some simple steps from moving forward? Using this data, using the tools here, what are some good next steps?
That's such a great question. We get that often. If you go back to the theory of change that we talked about, the rankings are really there as an opportunity to call your community to action and to mobilize people. So one of the first things we'd say is, well, use it to your advantage. Work with media, work with the different folks in your community to get the message out that you have a vision and for creating better health for everybody in your community, and that you want to bring people together to talk about what can be done and what is perhaps already being done and how you might better collaborate and harness your collective power. We know that in a lot of communities there's an awful lot of hard work going on, but everybody is working, many people are working in silos, and they're not, perhaps don't even know about each other as much as they could. And so there could be better cooperation and coordination, if not outright collaboration. So we'd really encourage you to use the rankings as that call to action. Another thing we would direct your attention to is going back to the action cycle in the Action Center. Take a look at that, and from the Work Together guide, which is about how to reach out to the different folks in your community, to digging into your data, the assessing needs and resources, and focusing on priorities, and figuring out how to get the community's voice into the change process itself, so that the communities are really leading the change and not having change just done to them. All of that guidance is in there in the Action Center, and it's spelled out in the step-by-step guides. And then the last thing I would say is, get in touch with us. Feel free, come to the site and get in touch with a coach. That coaching is available at no cost, as we've said, from the Robert Wood Johnson Foundation, whether it's a call, an email, or even a longer-term coaching engagement. It's all available at no cost, so feel free to reach out to us. We do have 11 coaches nationally, and 4 of us are based in Madison, and we work with communities all over the country. So there's another question. Karen, we'll see if you can take this one on. A lot of folks want to know this one. Is there data available at the zip code or census tract level on our site?
That's such a great question, and it's a great question because, again, to the point of the County Health Rankings being a starting point, it is a starting point, but it doesn't uncover the disparities or the differences that might exist within a community that you might see if you start to look at that zip code or census tract level data. So it's a really great question. We don't, at this point, we don't provide that data on our site, but what we do try to do is help folks figure out how to find it. So I'm going to actually take a quick look at our website and show you a couple of places where you can find some additional information. So I mentioned briefly on the tour the Using the Rankings data tool, and I want to take us in there, and I'm going to actually click right into this section called Digging Deeper. Digging Deeper provides some suggestions for things to think about, additional questions that you might want to ask, to think about the differences among population groups or differences by neighborhood. We also include some information below, and I'm going to scroll all the way down here. For each of our measures, we let you know if subgroup data may be available using different resources. So let's take a look at, for example, adult smoking. So adult smoking, it looks like this data should be available by various subgroups. Not all, but some of the subgroups that we've indicated here in this table. And if you click on that, adult smoking, it will take you to a little bit more information about where you might look to find that sub-county data. So this tool, the Digging Deeper Measure Specifics, can be a really helpful place to get started in thinking about what sub-county data might be available. I'm going to take us to another section of the Using the Rankings data tool, and that's Finding More Data. Here you can find some data, some state-specific data sources, which is another really great place to check for sub-county data. And then some additional national data sources that could be helpful. So those are 2 places to start your search for finding data at those different sub-county levels.
Karen, we have another question somewhat related, how to integrate the rankings data into other data sources, more local or county data or state data, how to do that.
Yeah, I think it's an important point because we do understand that the county health rankings data, I keep saying it, but it is a starting point. It's not going to give you every bit of information that you might want to include in, say, a community health needs assessment or some other tool that you're using to understand the needs and resources in your community. And lots of communities will layer in other information, other data sources, and they'll look at it side by side with the county health rankings data, or sometimes they might find more up-to-date or data that's more meaningful that they use instead of the county health rankings data. Often communities will take the model and they'll use that model as a way to start thinking about what data sources they want to find that are going to be most meaningful to them locally. And sometimes that'll be county health rankings data, and sometimes it'll be other sources. But I think it's a great place to layer, or a great tool to layer in to a more robust needs assessment or look at the data that you have for your community.
There's some other questions coming in too, a lot of the focus on data. One person was saying, we have got some more data that could be posted, and so I would encourage you all listening to this that if you've got data that you think could be used at the county level, to contact us. We do have state teams that are aligned with our coaches here in Madison, and we work with those state teams and with our data team here in Madison to update the website, and that's coming up this year. We'll start doing that later in the fall, and we will add data sets. So definitely get in touch with us about that if you have some more data that you think could be helpful to your counties in your state. Is there something you want to add to that, Karen? Okay. Another question that was asked, and I answered this privately, but people were wondering how long we've been ranking. We've been ranking for 6 years, so we have 6 years of data at the county level for those rankings measures. Yes, and Karen.
I do have a point to add on that. So we have been doing the county health rankings nationally for 6 years, but it's important to remember that the data for each measure comes from different years. So the 2015 County Health Rankings is not looking at 2015 data. So I want to take a moment to just help folks see where they can see that information, because it does vary by rank. So I'm going to take us back really quickly just to demonstrate this to the Dane County snapshot. And I want to show you where you can see the year of any particular data point that you're looking at. So if I'm looking at, again, let's go down to one that we've looked at previously. If I go into children in poverty, and we'll wait for that to load for just a moment here. On the left, you can see the years of data used. For some of our measures, we're using multiple years of data, and for others, it's just a single year of data. But it is really important to note the year of data when you're looking at the data in your snapshot.
Great, thank you, Karen. We're just looking at some of the questions that are coming in. Let's see if there's, a lot of them have to do with the, digging deeper into the data, and I think, Karen, you've covered that pretty well. That in addition, just bear in mind that for the rankings data, again, it's simply a snapshot, and it's a starting point to have conversation in your community. We only use 35 measures. There's just a limited number of measures that are available at low cost or no cost, available at the county level across the whole country, and so forth. So if you would like additional data, go into your county snapshot. You can see additional measures that are not included in the rankings data. You can also go to your state and state page and see if there are additional data sources listed there. And depending on the state, sometimes they do have more measures that are available at the sub-county data level.
Moving a little further along in sort of the presentation and the website tour, we have a question from Carol about the evidence ratings and what works for health. So I'm going to take us back over to that for a moment so we can review that. We didn't go into great detail there, so I think it's a great question, trying to understand what the evidence ratings mean. So I'm going to go into what works for health. Again, I use that Roadmaps to Health drop-down menu in the orange navigation bar. And here I'm going to use this left navigation to go into our ratings. All right, so we have 6 different ratings ranging from scientifically supported down to evidence of ineffectiveness. And you may have noticed when we showed the thermometer that some of the ratings, scientifically supported and some evidence, are going to be in green. This is just to kind of help you see that, yeah, there's more evidence there, that we know more about those. And so that's why they get that sort of green shading there. But you can see a little bit more about each of the 6 ratings by clicking on the our ratings on that left navigation. When we were going through the tour, I also mentioned a little bit about the disparity rating. You can read more about that here as well. So I just want to point out both of these are great. If you're going to be diving into what works for health, these are great places to spend just a little bit of time to make sure that you know what you're looking at and have an understanding of that. Great question, Carol.
There was also a question from Marie about viewing cities that are considered the top performers. And I'm thinking about, we have a report that actually shows, you know, sort of best and worst by counties. We don't talk about cities, but performers, you know, what do they tend to have in place in terms of best and worst performance? So like a really top performing county would have high numbers in educational attainment or graduation rates, for example. So there is a report that it's called the Key Findings Report, and it should be on our site. You can look for it through the search button, and then Karen, it looks like, are you able to put it in the chat link? Yeah, she can put it in the chat link. So, so again, that may be of use. It doesn't directly answer your question, Marie, but it does get at what does top performance tend to look like when we're looking at county data. Well, we are at the top of the hour and a little bit beyond. This has been a pretty lively. Oh, Marie meant that for counties, so that so we will post the link for that report, and we are at the end of the hour. We really appreciate you being on our webinar, and we look forward to you all joining us again. If you're not on our email list, for sure you might want to join that, and we will always be advertising, promoting, letting you know when our next webinars are. These are all at no cost. And you can also go onto our website and find all of our webinars archived. Another way to stay connected with us is to follow us on Twitter at CHRankings, and you can also like us on Facebook.com/County Health Rankings, and of course you can email us at chr@match.wisc.edu to subscribe to our newsletter. And we'll just stop with the guiding question. We hope you feel inspired to reach out to others and take your next step wherever you are in your journey to building a culture of health in your community. Thank you again for joining us, and we look forward to hearing from you in the future.